Now I have a little visual here that we're going to look at. Okay, so now we're looking at our little visual. Envision this as a capillary, okay, obviously, and this is our interstitial fluid, and this will be our lymphatic capillary, okay, the orange. The purple portion of our capillary is going to be our artery aspect of it, the artery, and then the vein portion. All of this is our blood capillary. What's occurring is you're having a lot of transport that is occurring between the capillary and your fluid. So you're having filtration is occurring along the entire capillary going to our interstitial fluid. What you see in this interstitial fluid, these are cells, you know, with our nucleus, and these are representing, the green and the orange are representing, again, the transport and the filtration and reabsorption that's going to occur. So as we look at, so this is what we're going to keep in mind, and this is our interstitial fluid, and you have oxygen and glucose that are in higher concentrations in the bloodstream versus your interstitial fluid, okay? The cells, oxygen, nutrients, and that are going to diffuse, like we said, into the interstitial fluid, out of our capillaries into the interstitial fluid. Carbon dioxide is going to fuse in the opposite direction of what a lot of the nutrients are going to be diffusing in. Proteins that are too large to diffuse easily through this small little capillary that is no larger than the size of a hair on your head. The proteins are too large to easily diffuse through this membrane, so they will usually flow linear along the capillary. Now there will be small amounts of proteins that will leak out of the blood capillaries, and they will get into the interstitium. And once they get into this interstitium, what happens is there will be an accumulation of these proteins.
And we're going to do shoulder to elbow. And I have handouts for you that show that the basic techniques of how you clear the upper extremities with pictures that I usually give patients for home for them to do their own home massage. So now I'm going to work on the shoulder. There's shoulder collectors on either side. I think I did that before where I did the side to side like this. And I'm just going to go through and treat the whole arm now that you've seen the basic techniques, how I would clear somebody of that has a edema or lymphedema.
Now, if someone has edema, not lymphedema, you would do the entire process of clearing the trunk and the opposite side and the inguinal area as well.
If, just like the handouts say that we show the patients, that would be good enough for a therapist to do that. You would do the lymph nodes on the opposite side, the lymph nodes on this side, maybe the neck, and then just go across the top like that. But it probably would be good to do the other side also. But it's more important for people that have the lymphedema for that area. So now I'm going up, I'm doing the outer aspect of the upper arm and doing that 5 to 7 times. And now the same as far as now, because of your lymph nodes being down in this area, you're kind of moving on the outer aspect of the arm and then the inner aspect of the arm. That I'm doing that pump technique that I showed you before. And I'm also going to now go to the elbow area and show you how I do the elbow area. When we talked about the stationary circles here for the elbow, you can use your thumb to do the little stationary circles. And I do it in 3 different levels because the antecubital fossa does have some lymph nodes in that area, and that's a lot of times with the hand patients you have that have the subacute edema, you're having a problem in the forearm, let's say they're a wrist fracture, the elbow is one area that's really good for you to clear. And so this is an important area to focus on. And what I'm going to do if you can see that okay, is I'm doing one level above the antecubital region where I'm doing the 5 to 7 times, and I'm just using my thumb to do the little stationary circles. Then I'm doing right along the antecubital region. And then I'm doing just the distal aspect of it like that. So it's 3 different levels that I'm doing the 5 to 7 times of doing the stationary circles.